Now we are continuing our sessions on Pioneer the Possible. This will be with co-creating patient-centric healthcare and innovations. I hope our moderator for this session, Amrit Hinduja, who is the head of Business Sweden, Bangalore. Amrit, are you there? Yes?
Thanks, Sanju. Yes. Good to see you.
Great to see you, Amrit. So do I leave this over to you to introduce Maya Feistad, the State Secretary, and of course all the panel members?
Sure. I think we're all here, so I think we're good to go.
Okay, great. Thank you. And we are watching you here in Stockholm and looking forward to listening to this session. Thank you.
Great. Great. Thanks, Sanju. And it's great to pick up from the startup work we just ended with gaming to another important area, especially which has become more important in the last 1.5 years, health and healthcare. And how do we drive patient-centric healthcare and I think bring the patient more in the center of care, which has been the need of the hour. And today I'm very happy to host this session where we would like to maybe share how we have been co-creating, trying to pioneer something new under the India-Sweden Healthcare MOU. We call it the India-Sweden Healthcare Innovation Center. We have with us today Maya Feistad, State Secretary for Health and Social Affairs from the Government of Sweden, Dr. Randeep Guleria, Director AIIMS Delhi, Dr. Sanjeev Misra, Director AIIMS Jodhpur, Mr. Gagandeep Singh, Managing Director AstraZeneca, and Cecilia Oskarsson, my colleague and the Swedish Trade Commissioner to India. And we try to use the next few minutes to run a dialogue and see what have we been up to in this innovation center. And maybe, Maya, I'd like to start with you. I think you were there when we kind of sowed the seeds of the India-Sweden Healthcare Innovation Center in India. And I think you also met Dr. Misra and some of the members when they visited Sweden. So I welcome you to say a few words of opening.
Thank you, Amrit. And yes, I was there. It felt truly historical. I'm very happy to be able to participate a little bit in the continuation of this important moment. So good afternoon and good evening to some of you, depending on which part of the world we are in. It's my pleasure to address you at this very important India-Sweden Innovation Day. I'm State Secretary to the Minister for Health and Social Affairs. Maybe you already heard that. So in 2019, Sweden and India celebrated 10 years of collaboration within the field of health. And we are guided by the Memorandum of Understanding on Cooperation in the Field of Healthcare and Public Health, signed in 2009. And in 2019, I participated in the state visit to India by the Majesty's King and Queen of Sweden. And I did have the opportunity to witness the signing of the India-Sweden Healthcare Innovation Center with the Ministry of Health and Family Welfare in India, together with my Indian colleague. A very memorable moment indeed. And we can see over the years that research collaboration has indeed flourished. Policy exchange between our government and government agencies has been initiated, as well as increased trade between our countries. But to be able to further implement and integrate, for example, precision medicine in the health sector, new innovation platforms are needed. With many Indian companies now developing ambitious precision medicine research activities, I think the time is just right to partner up with Sweden. By showcasing Indian and Swedish life science solution, benefits of sharing technology and information, we can create a common ground for new innovative platforms. Discussions on platforms like India-Sweden Innovation Day will help us highlight questions such as what governmental support would be required to attract more industry, academia and business-to-business collaborations in this domain. What infrastructure is required to enable collaborations? What role can industry play to strategically promote precision medicine in India and Sweden? Prime Minister Modi and Prime Minister Löfven, as you know, have had several conversations where health and life science has been mentioned as prioritized areas for collaborations between the two countries. During the virtual summit on March the 5th, 2021, the two prime ministers welcomed the creation of a Sweden-India Health Hub at AIIMS in Jodhpur. The purpose of the Health Hub is to create a hub with joint knowledge and common solutions together with Swedish public agencies, universities, hospitals in the private sector. The India-Sweden Healthcare Innovation Center is indeed a good example of the kind of results our collaborations have enabled. Several programs have just taken off the ground with AIIMS Hospital during the past 1.5 years, including a joint oncology center of excellence, development of a physical innovation hub for startups, and creation of a skilling program in non-communicable diseases. The collaborative partners under the Sweden-India Health Hub have agreed on 3 thematic areas to start their joint projects. And these areas are geriatric care, precision medicine, and non-communicable diseases. And recently, we have had several joint workshops on, for example, geriatric care and precision medicine. And I'm very glad that the collaborations between Sweden and India have not decreased during the time of the pandemic. Quite the contrary, many new ways of collaborations are taking place. My hope is that we, the life science sector in the world, can keep the same speed and engagement with which the new and safe vaccines against COVID-19 were developed, going forward in even more areas than vaccines. I'm very much looking forward to today's discussion and how collaboration about patient-centric care for the future can look like. Thank you very much and all the best to you.
Thanks, Maya, for highlighting the importance of this health cooperation and as a key pillar in the India-Sweden cooperation. And I think rightly so, the India-Sweden Healthcare Innovation Center being developed by the AIIMS Institute in India has been a very powerful vehicle, especially the past 1.5 years since we started it. And I know Cecilia, the team from Business Sweden representing the Swedish partners in this, while AIIMS Jodhpur and AIIMS Delhi are the Indian partners. I think Business Sweden has played a key role in kind of creating this framework, but also a dedicated coordination and PMO, so to say, because we know these things require a lot of effort consistently. Could you, Cecilia, maybe highlight and maybe paint a high-level picture of what does this center really do?
Yes, of course. Thank you very much, Amrit. Well, indeed, it's a very unique framework that we have created. And our idea from the start has been to work closely with the healthcare stakeholders in India and together with them identify problem statements and improvement areas of mutual interest between India and Sweden where we can work together. And there is a lot that we can share and learn from each other within healthcare. We are 2 different countries, but many of our problems are very similar, such as rising non-communicable diseases, reducing infection control, and AMR. Hence, our aim with the Innovation Center is a holistic way to work with India towards developing best-in-class protocols and new model clinics via our Center of Excellence concept, but also fueling technology solutions through startups and supporting Swedish and Indian startups to fill the technology gaps. And lastly, also capability building through skilling. We need to continuously grow talent and adapt them toward new patient pathways. And by addressing those areas, we are able to, through this collaboration, drive a more patient-centric and outcome-based healthcare. The triple helix model, where we have strong hospital partners in AIIMS, the minister on both sides, and industry partners such as AstraZeneca, make this a truly Swedish and impactful way towards innovation.
Thanks, Cecilia. And I think you rightfully said, I think for any collaboration to thrive, I think working of the partners together is so important. And I think we've been very lucky to have the strong support of AIIMS Delhi and AIIMS Jodhpur to help us as thought leaders here to really understand these mutual areas and the gaps which we can work towards. And I think the past 1.5 years has really shown that we really need to work together as one team to solve global health problems, and you really need to co-create. And maybe Dr. Guleria, I think you have been in the forefront of this from the Indian side in a large way, and also been a part of a thought leadership document we are creating on healthcare in the after-COVID world. We can't say post-COVID, it's probably here to stay. Could you maybe highlight to us some of the key transformations we are witnessing in healthcare in India today?
Good afternoon or good evening, wherever you are, and thank you very much for inviting me. You're very right. We've gone through a pandemic, or we are still going through a pandemic, but there's been a lot of lessons which we've learned, which will continue to really guide how healthcare is going to be in the coming years. I think the most important thing is that we have to start working together. Different regions of the world have to start working together. The pandemic showed us that this is one world, we are a global village, and what affects one area is the other area is also affected, and therefore we cannot sort of do research or work in silos, and we will have to work as a team. Also, it showed us that we need to innovate in health. We need to innovate, and one thing that really came forward was the strength of technology. We were able to use technology to a very large extent in the health sector, which we were not doing in the past, to provide care to patients across the country and across the world because of the innovations that we were able to bring about thanks to technology. And I think we started off with what we call teleconsultations. It was something that doctors were not doing that frequently, but we started a whole system. We had the notification of the law, and now it is something that is considered routine, that you could have a teleconsultation or a follow-up with your physician without having to physically go to a hospital. And that is good from the infection control point of view. It's also very cost effective. It also led us to really look at other ways of patient care. The whole concept of eICUs. We have resource limitations, and therefore you could run an ICU remotely from a tertiary care hospital if the doctor had a connection with good connectivity with the physician out there. You could monitor the patient, you could monitor the patient's vital, you could monitor his ventilatory signs, his other parameters, including the medication the patient was getting, and actually be almost physically present there to guide the physician there how to manage patients. So eICU also became something which became part of what technology taught us during the COVID pandemic. I think we also learned the importance of webinars. We're right now here talking to each other across the world through the whole issue of having meetings which are virtual. And it showed us the strength of having virtual meetings, which was so convenient. And I think many of us have become used to this because it really decreases the time that we lose in traveling and other things like that. Also, I think it really, what it will bring forward is how this technology can be used in future in terms of preventive and promotive health. By using technology in this manner, we will be able to really guide patients in terms of management, be able to monitor them closely, and prevent acute attacks from happening before they happen by using various means of monitoring that can be done. Similarly, screening for healthcare, whether it be cancers, whether it be hypertension, whether it be diabetes, can be done using technology and using the healthcare force, which may be semi-skilled. You don't need to have doctors or nurses, but the technology can be used there. And that's where a lot of startups can really come in by bringing in this technology, which could be cost effective and be available in our country. Also, finally, I think this could also be used to increase awareness, both in the health sector for professionals, but even for non-professionals in terms of how they can actually be more guided towards preventive health. It could be looking at obesity, it could be looking at exercise, it could be looking at yoga. So many things that one can do which are helpful in having a good, healthy life, both physically and mentally. Thank you.
Thank you, Dr. Guleria. I think absolutely. I think a lot of things while were aware in the past, I think the past 1.5 years, as you pointed out, have been really fueled and accelerated in this process. In fact, technology is one of the key pillars of the India-Sweden Healthcare Innovation Center, and working with startups on both sides is one of the key areas that is being worked with in a very focused way. I also know that AstraZeneca, you have a very very value-driven approach with patient-centric care, science-driven care, where you have also used innovation as a key way to address some of these, both in India, but also through the AIIMS network. So maybe Gagan, I'd like to invite you to kind of maybe highlight to us, you work very close with the India-Sweden Healthcare Innovation Center. What has this led for you, and how are you working with startups in this vehicle?
Thank you, Amrit, for inviting me to this panel. It's always very exciting to be part of the India-Sweden Healthcare Innovation Center. A very warm good afternoon and a good evening to all my friends on the panel. I think we've all adopted technology, as Dr. Guleria said, and one of the things is the way we've now connected through these webinars. Absolutely. I think clearly, if you look at, where Cecilia left, let me start by there saying that diseases are getting more and more complex, intertwined. One of the things with COVID has been the intertwined infectious disease, with the non-communicable diseases like diabetes or others, which got, physicians were challenged to try and manage both together. And this is where India, as an example, has had its own set of challenges, which is because of the known challenges of inadequacies in our current healthcare system, shortage of staff, equipment over the years, which we've been plagued with. But I think what is, the last 2 years is bringing out is that potentially with technology, one can really leverage the best of the talent that you have in the country to solve some of the challenges which has plagued us as a country for multiple years, and provide healthcare solutions across a wide spectrum. Amrit, to your question on where is AstraZeneca's, again, I think the whole India-Sweden healthcare sits pretty close to our heart because, at the outset, our reason for existence is the patient centricity. We're in it for patients, and we like them to control more of their lives, have better quality of life, and live longer. And I think ISHIC provides that opportunity in a big way because of the affordable and accessible healthcare for all that it can be leveraged into. Very, very clearly, one of the panelists in the previous panel said it, that India comes with a can-do attitude, and I think I like to borrow that. And I think the can-do attitude is also about trying to find solutions which are more frugal in nature and not just look west and implement east. And that's what ISHIC is trying to do, is trying to really leverage. And for AstraZeneca, the AIIMS network is a collection of 20 AstraZeneca Health Innovation Hubs, and with the aim of bringing digital R&D and commercial together to create a home for patient-enabled innovation. So it's a very important investment from an AstraZeneca perspective, and I'm glad that India is participating in this. I can think of many examples, but I'll kind of just share one example which left an indelible mark on me, was the standout partnership with Cure AI, a startup identified and incubated with ISHIC, which uses AI to interpret chest X-rays and is able to identify 29 different conditions, whether it's tuberculosis or lung cancer malignancies. Not only, Cure AI has been deployed in India to screen for early lung cancer, but has also been scaled up across multiple countries. I think overall, I would say, this partnership, this platform for identification is promising solutions and deployment, not only in India, but across the emerging markets with the frugal innovation at the heart of it, and is a very important cog in the wheel for our Catalyst network. Thank you so very much for the invitation. Appreciate it again, Amrit.
Thanks, Gagan, and thanks for linking the importance of technology with patient centricity and not just technology for the sake of just having something innovative. And I think that also brings me very well to another very important way of working at the Healthcare Innovation Center, which is creating new patient pathways where such innovations can be fit in and bought in. Dr. Misra, at AIIMS Jodhpur, you run a Center of Excellence in Oncology developed under this program. Could you maybe drive us through how is this really enabling patient-centric care?
Thank you, Amrit. Good evening and good afternoon to all the panelists. We have Center of Excellence at AIIMS Jodhpur for cancer under the India-Sweden Innovation Center Hub and the collaboration. And at AIIMS Jodhpur, we have been involved in treating cancer from the beginning with radiation, medical oncology, the surgical aspects of it, all the diagnostics and all the lab facilities. But what we have seen that is that as clinicians and people involved with cancer care, at times we end up giving less time as far as the psychological support goes, nutritional support goes, and rehabilitation, because you get so much bogged down with your patient care. And this Center of Excellence, what has been there, that we have got now trained nutritionists, psychologists, people with rehabilitation, counselors on board at the same time, where we have your radiation, medical and surgical oncology, the 4 departments looking after patient care. And these people work closely with the core healthcare providers, doctors, and also at the same time the patient, they get on board with the patient care. So I think that really helps them in dealing with their psychological problems, getting involved with their rehabilitation, and then nutrition, because each region, especially at Jodhpur, people have different food habits, and so they're trained and they can counsel them as to the food which suits them, their if they're a Jain or if you're something that the food changes, so you can advise accordingly if you're taking treatment and what to go for. And I think it also helps our doctors, because that is one aspect which we also realized that once we started, that more focus can be given, and it gives the doctors to be giving this extra bit there, and you can give more time to the patients and they come on board. And this is a sort of a pilot thing which with the India-Sweden Healthcare Innovation Center, that is the Center for Excellence, is there. And I think this can maybe a thing which can be replicated across the country as we see. And we do look at the information, the data, the questionnaire, how it is filled, and it's in a very structured format. We even look at quality of life in these people who have gone into this study protocol for this. And I think this is something which is very interesting and good, and I'm sure that's going to have an impact on patient care. And we can go beyond cancer and look at geriatric care and this sort of thing, and also looking at skill simulation, etc. And I think that's what we would be working on in the future. And then also getting out, adding yoga and other components to this, and then reaching out to the society and with this. Thank you. That's in short about.
Thank you, Dr. Misra. Absolutely, I think this is indeed a very interesting way where you create these new patient pathways, which can be new models of healthcare delivery. You integrate technology, and I think also then bringing me to the third area that the Innovation Center works in this holistic way, which is upskilling. And maybe I invite you back, Dr. Guleria. I think last week when we met, we started to speak about this also as a very important area of upskilling of nurses, doctors, young physicians. How do you see this, the importance of upskilling in such an approach, Dr. Guleria?
So I think this is very, very important because of the simple fact that medicine is changing so rapidly. We're actually living through a revolution. What we learn today becomes irrelevant tomorrow. And I think the pandemic has really shown us that the type of knowledge that changed, or our management strategies that changed in less than 2 years, was breathtaking. We started off with drugs like hydroxychloroquine. We moved on to other drugs, and then we looked at remdesivir, we looked at steroids, we looked at anticoagulants, and then we started looking at monoclonal antibodies, convalescent plasma. I think we've been through such a lot of change in the last 18 months that it has shown us how evidence-based medicine is changing so much. And this is happening in all areas of medicine. I'm just giving you an example of COVID because that was breathtaking. But you take any area in medicine, you will see that there is such a lot of change that is happening. And therefore, for the future healthcare workers, whether it be paramedical people, whether it be nurses, whether it be doctors, we have to have the training built into any program that we do. Because if we're looking at doctors for the future, they have to have the skills to manage patients at that point in time with the best available knowledge, with the best available techniques so that they can provide the best care for their patients. That, I think, is paramount, and that is what we need to do. So with changing times, with technology, we need to really develop new strategies. And I think that is something that we're also doing at AIIMS New Delhi. We have set up a whole SET facility, simulation, e-learning and telemedicine. That's what SET stands for. And it's basically trying to use technology to train nurses, paramedics, and young doctors or undergraduates in various skills so that when they pass out and when they go into practice, they are confident that they can manage patients with the latest technology that is available. But I think it's very, very important that we develop strategies so that we can roll it out to a larger way, to a larger population. And that's where we have to look at various things. I'm not saying we can change things overnight, but we have to look at various strategies. It's like blended learning. How can we mix and match new techniques and new technology with traditional teaching methods so that students are able to grasp things which are required? Today, students argue that they don't need to know all that is available. Like we used to have to really mug up everything 20 years ago. Everything is available on your smartphone. But how best to use that is more important. If I take the round in the hospital and I ask a question, I know the person who's answering at the back of the group is the one who's Googled it and has found out the answer and is giving me the answer rather than knowing about it. So it's how you use your knowledge better that is important, and how you can use the skill that is more important. And that is why I think that skill training for all healthcare workers is important, because they can also assist the doctors. They can help in preventive medicine. They can help in promotive medicine. They can also help in increasing the pool of quality care that we can provide to our patients. So I feel that this is a very important area which we really need to work aggressively on, because there is a lot that can be done, and it's something that needs to be done not only at an India level, but at a global level. Thank you very much.
Absolutely. And I think by saying that also, thank you for closing the loop in many senses, bringing, we started a technology, creating new center of excellences, skilling, and back to the importance of technology. I think it's so intertwined, as Gagan, you were highlighting. It's a more complex world than before. So Cecilia, it looks like a lot of interesting, impactful work is being done. And to just wrap up, maybe I invite you back to what's the vision ahead of the India-Sweden Healthcare Innovation Center?
Well, thank you very much, Amrit. We can say like this, despite the situation we have had during the past year and a half, we have achieved a lot during this Healthcare Innovation Center, and that we've heard today by my co-panelists. We've heard about the Oncology Center of Excellence. We've heard about the work we're doing with the startups and helping them scale up, and how we have identified the first skilling program in the diabetes management that we started actually this morning. But we have a lot more in the pipeline, and I can say, I dare to say that the ambition of us, but all our partners as well, is to have to strengthen the current work that we're already doing, and to set examples towards adding a dimension of cancer screening and patient education and awareness in cancer to the current Center of Excellence. We are also building another Center of Excellence together with our technology partner, Scandinavian Chemotech AB, at AIIMS in electroporation for tumor-specific cancer. And then we are continuously discussing to identify more therapy areas to work with, including infection control and AMR and geriatrics, and also to build more on our work that we already are doing in non-communicable diseases area. But we also would like to say that we would like to invite more Swedish stakeholders to join us in this vehicle that we have created, both universities but also companies, to work with us and to explore how this action-oriented collaboration and model can work towards joint areas and interests and partnership. I think that sums it all up, Amrit. So thank you very much for today.
Thanks, and I see Sanju waiting for me there. Great, Sanju. And then with that, I thank everyone and hand back to you.
Thank you. And from Stockholm, thank you so much for this distinguished panel and for, of course, one of the most important areas that concerns each and every one. So thank you for your insights and also for showcasing the opportunities of where we can head and what are how Sweden and India in your healthcare innovation can work together to make everyone's health better. Thank you so much. This was so important.